Veneers are restorations that cover the front surface of a tooth. While they can improve function, most of the time veneers are used to improve the appearance of a patient's smile, whether a tooth is misshapen, chipped, discolored, or rotated. Veneers can be made of ceramic or composite material and typically require multiple appointments to complete. At your first visit, your doctor will take an impression of your teeth, which will be sent to a dental laboratory to expertly sculpt an idealized model of your mouth. This model will be the basis for your temporary and final veneers. During your next visit, your teeth are prepared by the doctor to make room to place the veneers over them. Once done, another impression is taken of the prepared teeth, which will be sent to the dental laboratory and combined with the idealized model to craft your final veneers. After this second impression is taken, temporary veneers are placed over your teeth until the final ones are ready. At a subsequent visit, your doctor will remove the temporary veneers and bond the final versions into place. Now your teeth are restored to optimal shape and function, and your smile will be greatly improved.